Welcome back to this Econ 101 session with yours truly, Kevin Thompson, founder and CEO of Non-I Capital Group. And today we're talking about artificial intelligence and Medicare. A lot of my clients are retirees and they're dealing with Medicare. And we're going to talk about the system today and how AI is transforming the pros and the cons in regards to the Medicare system, how privatization is becoming not just a buzzword, but more of a reality, and what things you need to be considering when we talk about these things in the future. This is for the elderly, this is for the retirees, this is for the pre-retirees, people that are walking in retirement, because things are changing. You just got to be aware of it. So buckle up. Thank you for joining me for this powerful episode, because I think it's going to be something that needs to be discussed. So things are changing. It hasn't been written into any kind of law, not through any dramatic announcements, but more through gradual changes, more private investment, more cost containment, more prior authorizations, more AI systems, more barriers to entry between patients and care. Now, I want to say this. The current administration came out on television, and again, this is not political, on television, and said, we can't afford daycare, Medicare, Medicaid. Now, regardless of your politics, I think that quote tells you a lot about where we're headed or where the conversation is heading longer term. Because once the narrative shifts, we can't afford it, the next question becomes, well, then who manages the cost? And increasingly, the answer has become private companies, algorithms, and systems designed around, you guessed it, reducing expenditures. So that brings us to what is happening right now with AI and prior authorizations inside of Medicare. One of the newer systems being designed is called the Wiser system. I've spoken about this in many articles on Newsweek and other magazines. They're asking me questions around this, and I've studied it quite extensively. Now, the language sounds harmless. The stated purpose is to avert expenditures. Avert expenditures, but let's call it what it is. That's a posh way of saying reducing spending. So, when healthcare systems are told to reduce spending, one of the fastest ways to do it is through tighter approvals, stricter reviews, and delayed authorizations. I said this recently in one of my media quotes. The Wiser model is designed to avert expenditures, which is a kind way of saying increasing denial rates. And honestly, I stand by that statement, because once you introduce AI into systems whose incentive is cost reduction, the natural outcome is going to be more filtering, more hurdles, more reviews, more delays. Now, the supporters will argue, Kevin, AI can streamline a process. Yeah, you're absolutely right. It can reduce waste. It can produce efficiency. Now, a lot of cans are in there, but what it's currently doing is what I recently said. And sure, in theory, that sounds great, but healthcare is not Amazon. These are real people, real illnesses, real fear, real families trying to navigate complicated systems while under stressful situations. And many seniors are struggling with prior authorizations today. Before AI fully enters the process. I've experienced this currently with my own father. We had to appeal. We had phone calls. We had waiting periods. We had to wait for these different approvals, repeated approvals. And if you're elderly and don't have a strong family support, helping navigate the system, it becomes an exhausting policy. That's the part of the system many policymakers miss. Sometimes the denial is not a formal rejection. Sometimes the system simply delays people until they stop fighting. And that's why the conversation matters so much. If my father didn't have a strong family unit that was able to make these hurdles on his behalf, it would have been a much worse outcome. Now, I've spoken about this extensively, multiple articles. I've written about it on my Substack as well. I think the bigger concern is the philosophical shift between Medicare and the system itself, the current administration, the system itself, the shift that's happening underneath Medicare itself. Medicare was originally designed around access and security for seniors, but over time, more private incentives have entered the system. More Medicare Advantage growth, more outsourcing, more utilization management, more prior authorizations, and now potentially more AI-driven decision making. And when profit incentives meet healthcare necessity, tension is inevitable. Because if the incentive is to avert expenditures, then limiting utilization becomes part of the business model, whether people want to acknowledge it or not. Now, I also want to say that people are getting access to data. Private companies are getting access to people's medical data. And the AI algorithms are making decisions based on that medical data, medical history. It was funny on my, we were speaking to a doctor, and my brother was speaking to a doctor, and my brother said, "Hey, is it taking so long because the insurance company was thinking he may die, and they may not have to approve this?" And it's like, that's quite possibly it. Yeah. So you're having insurance companies that are looking at someone's life as a number on a balance sheet, a revenue number on the balance sheet. You have hospitals looking at it as a cost containment on their balance sheet. So people are balancing these life or death situations as a cost containment. Now, politically, you're starting to see pushback. Some lawmakers are calling AI-driven systems to be removed from prior authorizations decisions altogether, which again, I do agree with. Will that happen? Honestly, I doubt AI is going anywhere anytime soon. The healthcare system is simply too expansive and too expensive to administratively, and also too administratively bloated for organizations not to pursue automation. But the real question is, how much authority are we going to hand over to algorithms when human health is involved? That's the larger issue. Another, like I said before, another huge issue is going to be information gathering. You're giving these people, these algorithms, these computers, your information. That's a liability that needs to be tracked, and that needs to be something that needs to be addressed, in my humble opinion. And if you're over 55 or older, this matters right now, because Medicare 10 years from now may look very different from Medicare previous generations experience. More automation, more gatekeeping, more oversight, more cost containment, and potentially less human discretion. I don't think this is just another quiet policy debate happening in Washington. I think this is one of the defining healthcare conversations over the next decade, especially for retirees, especially for caregivers, and especially for the middle-class Americans who paid into the system their entire working lives, expecting security on the other side. They're wanting to privatize the system. They've said it and they said it before, and they'll say it again. They want to allow private companies to come into the system, because what they're doing is lowering reimbursement so much currently that doctors basically go out of network. And what you're seeing also is that, and I've said this in a couple of articles, that some doctors are no longer taking Medicare patients because the reimbursements are so low. So for you to have your doctor, you would have to pay them out of pocket. Now, there is a system where they're saying, okay, that's fine. Let's just say your doctor is out of network. Well, if your doctor is out of network, what they're trying to do is say, okay, we'll repay them the reimbursement rate. But if you want to keep your doctor, you have to pay the additional cost that he's going to put over the top of the reimbursement rate. And some people are willing to do that because they've had their doctor for 30 years. But think about that. You're having to make a decision because your doctor's opted out of Medicare or Medicare Advantage. And you're having to make a decision based on the fact that your doctor is no longer in the system. And you're having to reimburse the doctor yourself. It's a bad situation. The same thing with Medicare Advantage right now. Medicare Advantage, this is a whole nother podcast, but Medicare Advantage, there's issues where people can be in Medicare Advantage, their doctor is in their network, but the hospital or the administration or what have you may be out of network. And that leaves you with massive, massive bills. So the system is entirely too complex. I'm not going to get political and talk about single payer or anything like that. But what we're going to talk about is that one thing, and I want you to remember these three things. One, we can't give our personal data to private companies. That's one thing. Our personal data should not be provided to private companies for them to make a decision on behalf of us living or dying. That's first and foremost. Secondly, you've paid money into the system your entire life. And now what the current administration is trying to say is that, no, we want to push that over into private industry. Now, your money is being used to reimburse private industry, which, again, there's nothing wrong with that. But you can't necessarily have a system, like a Medicare system, that's been working this way for a long time, over 60 or 70 years, and now say that, oh, we want to take all this money and give it to these private insurers and let them deal with it. But what you're trying to do is you're trying to bring down reimbursements to make it so unappealing that doctors just move out of network and do something else, and now you force the system to change. I get it. You're making differences. Differences happen. But we have to make sure that people are taken care of because, again, I have my qualms against Medicare Advantage, but I love traditional Medicare. And that's going to be a whole nother podcast because I don't believe most people need Medicare Advantage. And the people that are on Medicare Advantage are probably the people that shouldn't be on Medicare Advantage. And finally, part 3, family units. Having a strong, well-connected family unit will allow you to parse through all of the noise that will get your prior authorizations through, because it's going to take multiple prior authorizations. They're trying to bring that to Medicare now. That's Medicare Advantage prior auth for every single procedure. Now they're trying to bring that to Medicare. It's not a good thing, and we have to stand pat and be on time with what we're trying to do with our Medicare system. Because if we're not in front of this, things will change. Thank you guys for listening. If you enjoyed today's episode, make sure you subscribe, support, and share this Econ 101 on the 9 Innings Podcast. Available on Apple, Spotify, YouTube, and anywhere you get your podcast station. Thank you. And as always, stay humble, stay safe. I'll see you again soon.